Welcome everyone to 28. So we're going to go through the anatomy of a viva and how to prepare. And I just want to say congratulations to everyone here because you've all set the written, you've all gone through it. And now it's time to prepare for the viva. And the viva is a lot more fun, a lot more interactive. And I encourage you to put 100% of your efforts into it. Now, with the anatomy of the viva, I'm just going to go through just the structure of it. And I think a lot of you will know this already, but there are 3 vivas. And of those 3 vivas, when you sort of start off, there's about a 2-minute reading time for the opening question. And I'll show you some examples of what the opening questions are. And the way to think about this is that within sort of that 20-minute vivas, there are 4 stems, each of 5 minutes, approximately 5 minutes long. So altogether, you'll be asked 12 topics, and you'll be examined by 2 examiners, and there might be an observer in the back. So there'll be about 2 plus minus 1 other person there. Now, the structure of it. So the thing to know is that it's a structured question and answer format for 5 minutes. Your target should be to get at least 10 questions being asked in that viva. So approximately 10. Can be about, I've seen about 8. 8's okay, but 10 is probably where you want to target. Now, merit prize winners, if you actually see their viva stems, can go up to 20 questions per stem. I think knowing this allows you to understand what you need to do. So this is not an oral thesis exam or an oral dissertation. All your answers, right, should be completed within 20 seconds. And 20 seconds is being generous. I think the idea is that you want to complete it almost within sort of 15 seconds. Now, this is important to know because you'll probably do vivas with other consultants where, they might ask you an open question and they'll ask you to speak for 5 minutes. That is not how the viva is going to be on the day. I think it's okay to go through that experience, but certainly, if there's a critique from that person giving you the viva that, why couldn't you talk for 5 minutes? Don't feel terrible at all. Okay. This is not the format. It's a very closed format in terms of the questions asked will have very specific answers to them. And it's back and forth. Okay. For that 5 minutes. Now, the 2-minute reading time that you get for the first opening viva question. So these are the ones that you'll get at each viva stations. And I've just shown you an example of what the ones that were written in the last sitting. So the first one is, how does dexamethasone prevent nausea and vomiting? What is saturated vapor pressure? What is tramadol? What do you do within that 2 minutes? And this is something to sort of practice. So you prepare a response that can be answered in less than 20 seconds. And a lot of times when you've done enough vivas already, you will already know what you're going to say. And pretty much a lot of trainees, what they'll do is they'll just spend time just relaxing in that 2 minutes. Like, I don't think you need to overthink it. You don't need to overthink the stem because they will go down a certain route. And when you do enough vivas, you'll actually see, and I'll show you some examples, as we go through the next couple of weeks, how these vivas develop. Okay. So I just show you sort of the progression of the vivas here. So the opening stem was, how does dexamethasone prevent nausea and vomiting? And that led to a 5-minute discussion on a wide array of antiemetics. The second station, the opening question was, what is saturated vapor pressure? That led to a discussion on vaporizers. And then the third station was, what is tramadol? That led to a discussion about the CYP2D6 metabolism and the differences in terms of the ultra rapids, metabolizers. Now, this is something I want you guys to practice. So this is the art of a viva. There's people, and I think a lot of consultants probably won't tell you this, and I don't think there's so much, as much importance as there is, but I think it does make a difference. So it's the idea of, non-verbal persuasion. And it's that idea that you maintain eye contact. So about 50% when you're answering the question, and certainly when you're listening to the question, look at the examiner just to engage them as well. So 70% of the time should be spent looking at the examiner when they're asking you a question. Be confident, be positive, but also be receptive and humble. And the posture is so important. And I know you guys are going to laugh at me, but it's an upright sitting posture with a 10-degree lean forward. And I say that because that is probably a very warm and accepting posture. You don't want to lean too far forward, and certainly you don't want to lean too far back, just to sort of be, I think you want to sort of exude that sort of right temperament for this exam. And then you can put your hands on your lap or on the table, certainly not, across your chest like this, or up against your head, or even, what else have I ever seen? I've seen people fidgeting a lot. Okay. So key things are hands either on your lap or on the table together is fine. Now you have to enter with the mindset that the examiner wants to help you pass. And I'll show you a couple of ways to sort of phrase a couple of statements that can sort of help you along the way. Now, if you have trouble answering a question and you want to ask an examiner for a clue, you can actually say it. You can actually ask them for a clue, but you can do it without saying clue. So what you can say is, I'm sorry, but can you rephrase that question? And that's another way where the examiner can actually put the words, put the question in different words and actually give you a clue in terms of what they're asking. You can guess. And I think the way to guess is to frame it is that, look, you can say, look, I'm not sure about the answer, but going from first principles. And that shows to the examiner that, all right, you're actually applying concepts that you know, and you are applying it to an answer that that they're asking. And that's what they want to see. They want to see you sort of applying those concepts that you've learned throughout your study. And finally, it's okay to be wrong. Okay. And certainly even during my vivas, I was corrected about almost 4 or 5 times during my viva. And I think what you can often say is just look off, you say thank you. That makes absolute sense now. I think what you want to avoid is being argumentative or being confrontive with some concepts, even though you think you may be right. It's probably worth just letting the flow of the viva continue, because you'll get many more opportunities to answer a lot more questions and to show off your knowledge. And you want the examiners to be on your side. You want the examiners to go, hey, this was a really good viva. I'll give them a good pass or a pass on this viva. Now, here's a very scientific analysis of the viva. So the normal speaking rate is approximately 150 words per minute. If you actually look at vivas that other people, other trainees have written up, if you look at the amount of words that they actually write on the page, it's approximately about 400 to 500 words. So you're looking at about 80 to 100 words per minute, and that's them interacting with the examiner. Now, what's been shown is that faster speakers, so if you speak about sort of 200 words per minute, are considered more credible than slower speakers at 102 words per minute. And it is unfortunately a fact of this viva, is that if you can actually eloquently discuss ideas in a very proficient manner, I think it just helps with the flow of the viva. Now, if this doesn't come naturally to you, this is something that you have to sort of work on through this whole process in the next 8 weeks. And there will be very common recurring themes, which I'll sort of go through, which will hopefully give you that good practice in speaking clearly and efficiently. So at the moment, I'm speaking at about 200 words per minute. And let's say I've got a question like, what is hypoxemia? So I can go, hypoxemia is a PaO2 less than 60 or saturations less than 90. And that's about 200 words per minute. But if you go, this is about 100 words per minute. If you go, what is hypoxemia? And I go, hypoxemia is a PaO2 less than 60 and saturations less than 90. You can see already that just having that pace really brings up a lot of questions in your head, even though factually correct, it doesn't seem to have that same sort of credibility that you do just speaking on a faster pace. Now, I'm not asking you to speak at 250 to 300 words per minute, because I think once you do that, you tend to lose that ability to actually get your concepts across. But about 200 words per minute is where you want to aim for. So how do you prepare the next 8 weeks? Every viva that you do, you want to develop two things. You want to develop your knowledge and content, and you also want to develop how this knowledge and content is being delivered, both through non-verbal persuasion. So in other words, posture, hands on the table or hands under the table. And that can be quite hard for some trainees to do, but it's good to sort of practice this very, very early on. And the other idea of verbal persuasion, which is the idea that when you talk about concepts, initially you're going to be a lot more sort of unsure, uncertain, slower pace. But as you get the questions being asked over and over again, you sort of go, hey, yep, I've heard this question before, and I've got a really good answer for this question. So this is a very, very social exam. Now, at the start, this is pretty much what happens. So it's almost analogous to Chinese whispers. Your eyes are telling your brain, this is what I read. Your brain is telling your mouth, this is what you should say. And your mouth goes off and says, this is what I'm saying to the examiner. And the examiner just goes, no, that is absolutely not correct. What you want to do with this viva is that you want to be able to also listen to other people giving their answers. And that is a facet of both listening to someone else being viva'ed and also giving that viva to someone else. And so that what happens is that your eyes and your ears now, okay, play a role in terms of understanding the concepts that are being discussed, so that there's symmetry now between your eyes and your ears in terms of what you've read and what you've heard also. And then your brain and your mouth can actually work together to know what you need to say. And that's how you get really, really good answers across. So it's not just about being viva'ed, it's also about listening to your peers being viva'ed and also giving vivas to your peers as well. And, you know, a really good sort of technique is that any vivas that you get from, you know, another consultant, write down those questions and then give it to someone else and see what their answers are like. And then after that, you know, compare it to yours. And then you can sort of pick and choose and go, hey, that sounds like a really good way to answer that question. I'm going to use that for, you know, the next time if I get asked something quite similar. Now, that there are recurring themes that you'll see throughout this whole viva experience. So the ones that you'll see are questions related to definitions, and they are very common. So a question like, what is preload? Very common question, and you'll hear multiple ways to answer this question. And that's great, because then after that, you can sort of pick up what you want to use for this exam. Then you'll also get questions related to explanations. So an explanation would be like, what are the factors affecting preload? Again, very common questions, and you'll get to hear a wide variety of answers in terms of how to answer that question there. Now, the third ones are the most challenging. They're a little bit uncommon, because they are really pushing you in terms of your application of these concepts. So a question could be something like, why is preload reduction beneficial in patients with cardiac failure? And how does it affect the preload function curve? And draw it out for me. So these would be very uncommon questions, but if you do enough vivas, you'll at least hear about it once, and that way that will give you an opportunity to have a think about them. But once you reach that stage, it actually means that you've done really well in terms of the definitions and the explanations, and it's really about sort of pushing you further in terms of how much you know and how much you can actually apply the concepts that you've learned. Now, other recurring themes are the drawings and writings related to values, graphs, equations, diagrams. And the most common ones that you'll see is for normal physiology and normal pharmacology. And it's really good because when you do enough vivas, you get asked, draw me the pressure volume loop of the left ventricle, or draw me what happens with compliance in the lung. And you'll get these common graphs or common equations that you consistently get asked to draw over and over again. And it's really good practice because it allows you to think about a very efficient way to think about how you want to draw these diagrams. And you can even ask your peers, during a viva, like, draw me this diagram, and you can see the way that they draw it and see whether they've got really good ways that you can sort of pick up to make your drawing a lot more efficient. Now, what's uncommon are values, graphs, equations, or diagrams related to physics, clinical measurement, and equipment, and abnormal physiology and any abnormal pharmacology. These ones here, you just have to do a wide breadth of vivas to actually get sort of to sort of touch on those sort of diagrams that are related to those key concepts. I'll run through sort of ones that I've seen, so in the next couple of weeks, and that way, hopefully, it will sort of give you that experience that you need to be successful in this exam. Now, how do you go about preparing between now and then? So it's important to experience the viva both as the trainee as well as the examiner, okay? And in the next 8 weeks, I talk about viva experience hours, and I think, 50 viva experience hours is an achievable aim for everyone here. And that is pretty much 25 hours of being viva'd. So that's about 30 to 40 minutes a day for 5 out of 7 days. And that's being very conservative. And after that, also having 25 hours of listening to someone else being viva'd or giving a viva. And that's another 30 to 40 minutes a day for 5 out of 7 days. And when you sort of look at it in terms of how many vivas you're getting, so if you look at this and 30 to 40 minutes a day, hopefully, you should be able to run through 6 to 8 stems a day. And let's say that's 40 a week. And that is about 320 topics, okay, that you'll be able to get through with this. And that should give you a really good coverage of what's out there. And I'm sure that hopefully a lot of you have vivas that, that you've had other trainees give you, but I will post them up as well on the Patreon page, just with some examples of some previous candidates' vivas that you guys can sort of work through. Okay. Now, where do we go from here? So how do you mobilize your resources? Use your study group. You can also use patrons in this group as well. And I think this is pretty much how I sort of envisage this idea, where we've got so many trainees around Australia. And I think it really gives a really good opportunity for those out there just to connect with everyone here and to really have that broad experience about learning from each other. Now, you should also use the consultants, fellows, and registrars in your hospitals. And I know that some hospitals will probably be more fortunate than others. At our network, we've got about 25 to 30 consultant fellows and registrars at any one time, who I create a roster for my registrars to essentially give these Viva experiences every week. Okay, and I know that it can be difficult for those in peripheral hospitals to do that. One of the ways around it is to essentially just give someone else the Viva stem. So give them, just say, look, I've got a Viva stem, just ask me these questions. I just want that opportunity to have someone there listen as I talk through these concepts, so that it allows me to hear myself and allows you to hear me talk as well, to make sure that what I'm saying actually makes sense to you. And look, what I'm going to do also is I'm going to create a Zoom meet every Sunday between 2 to 3 p.m. So it'll just be, I'll have like a Zoom link open, and I think, we can all, and whoever wants to come can just come, and we'll come, and then we'll just go into breakout rooms and we'll just Viva each other for just for an hour every Sunday between 2 to 3 p.m. All right, so I'll set that up for you guys here, just to sort of join if you're free. Okay. Now, this next phase, I know that you guys have went through the written. I know a lot of you also are feeling it's very natural to feel a little bit disheartened as well when you sort of go through it and you go, oh, I should have written this, or I could have written that, and I'm so fearful of not passing. Forget all that. In all probability, all right, in all probability, you all have passed. Okay, and the worst case scenario is that you've scored 30 out of 75 to get yourself a Viva, which means that you need to score 60% in this Viva examination, which is a lot more achievable than the written. It is definitely a lot easier to do better in the Viva than it is to do in the written. But it requires 100% of your effort and dedication starting from now, and you have to go in with the mindset that you've passed the written. Because what happens is that I've had in the past where trainees have been so concerned about their written, they feel like they're not able to put in that 100% effort and dedication, and then surprise, in about 4 weeks' time, they have the invite to the Viva, but they've lost that 4 or 5 weeks of preparation, and that other 4 or 5 weeks is not enough to get them up to speed to the level that they needed to pass the whole exam. So I'm confident that you start from this week, and you do your hour of Vivas a day, just for 5 days. So half of it getting Viva'd, and then half of it giving a Viva or listening to a Viva. You will experience so much that you will have the knowledge and the ability to also deliver that knowledge well, to do well in this exam. So just a couple of notes is that this whole process, you should never stop learning, and never be frustrated about learning new things, even the day before your Viva. Like, I remember the day before my Viva, I always knew there was a correction factor in the LVL gas equation, but I never knew exactly what it was. And I just so happened to flick past it and memorized it. And so fortunate, on that day, one of my Vivas was the examiner asking me to expand on what that correction factor was, and I couldn't believe it. So these things, I think, just serves as a, hopefully as a signpost for you, is that never stop learning, even up to the day before, or a couple of days before the Viva. It's always a good opportunity to always get better. Now, you've all put in the hard work, you all deserve to pass, and go in with the mindset that the examiners want you to pass as well. And that will help you. They're not there to be your adversaries, they're there to help you, and use that to your advantage. Use the ideas that, yes, you can communicate with them to say, hey, can you rephrase that question? Because I didn't really understand what was initially asked. And also if they want to correct you, I think that's a fantastic sign to you that you're doing really well. Like, it means the examiners like you. Okay, so if they're there telling you, like I remember I was doing one question on pain and the withdrawal reflex, and I think the examiner asked me what happens on the contralateral side. Do you flex or do you extend? I said you flex both sides, and he goes, no, you actually extend the contralateral side. And I went, I said, fantastic. I said that makes sense. And then on to the next question. And lastly, I want all of you to pass. So I will do everything I can to make sure that you guys have the complete experience that I think is required for you to be successful.